Vacation. It is time for vacation. And I learned a very good lesson 2 years ago when a friend of mine got sick in Canada. Well, he or she called me up, blah, blah, blah. Good friend of mine. I've known this person for a long time. When you have a Medicare supplement, the $250, $270, a higher premium than zero, and you know it's a Medicare supplement, you have a $250 upfront deductible for your vacation if you're injured or ill on vacation in Europe, in Canada, in the United States. We'll go over that later. You just simply use the emergency room. But this is for the foreign traveler. Vacation in Italy. I have a good client from Nagaduk right now who's in Portugal. So on a Medicare Advantage plan, you have with an Advantage plan a UHC Passport program, one of United Healthcare's best benefits. It's called the Passport program. You simply turn the phone number over, 1-800-711-0646. Hi, it's me, member so-and-so. Put me on the Passport program. Always remember, it's in-state as well as out of the country. Mostly, you have to call when you get back. All right? It allows you to travel throughout the country freely. With Aetna, Europe is also unlimited, like United Healthcare. They're both unlimited. Also with Aetna, you'll have an open access plan. Poor Lisa had several callers in the beginning of January and February freaking out saying, wait a minute. And Gene and I were told by our rep, look, no, they can use the open access program. And the clients were in Florida saying that they're being shut out of the network. Well, of course, she's great, so she got it fixed. But make sure you check. Put down the glass of wine for a quick second, go get your card, and I'll take a sip of your wine while you're waiting. And you would simply call Aetna, call United Healthcare, call Connecticut. How am I going to be covered down there? With Connecticut, you know us by heart. Connecticut is only emergency room. You're going to go to a walk-in clinic or the ER. Client that was in the office yesterday has a vacation home in Cape Cod. We looked in the area, no go. So she's still taking Connecticut because they're a great company and they have a good drug formulary, and she liked this particular doctor that is not in Aetna or United Healthcare, so she went with that carrier. But that plan is a $50,000 annual, not lifetime, annual maximum for vacation. So basically get your butt back home as soon as you get sick. And then you have the option of going to a $65 emergency room copay at any hospital. Now, Kristen said this eloquently yesterday. Well, in the event of an emergency, it's an emergency. You can go to any hospital. Gene and I have known that for 20 years, but it's good to see that the knowledge is being passed down to the rest of the staff because she didn't hesitate. She didn't put the person on hold. Boom. She knew the answer. What's that mean to you, the listener? You just go to any emergency room when it's an emergency. Now, another thing I've had happen to me, if it's not an emergency and it's not CPT, current procedural terminology or technology, whatever that lovely woman from Prospect told me a couple of years ago, CPT, if it's not CPT coded for an ER visit, you've blown it. So I had a client in Cape Cod get sand in their eye last year. We asked for a one-time exception and the carrier ended up not paying it. So he had to eat the $120. It was just a doctor visit. He went. You don't forget these things when you're an insurance agent because this is what gets people mad. And another thing, if you can, the new thing now is just yelling at everyone. If you can try to just calm down. We know you're mad about something, but don't yell at us. We are here for you. We're good agents. We work hard. We study hard. We work 8:30 to sometimes 8 o'clock at night. When you call up, remember you're talking to a human being and we didn't give you a voicemail or a phone chain. Like press 1, press 2, press 5, press 8. It's, hi, G.S. Regan, how can I help you? Please try to refrain from just yelling at me and my staff because it is hard. This has been the hardest year of our lives. And we just got some bad news for the industry in general. Not a carrier-specific type, but things are going to change in the future. These zero premiums with all these bells and whistles, every carrier is going to sooner or later take it away or reduce it. So you will be more worked up in the future. We will take a proactive approach. We will educate you on this. So, second commercial break. Let's take it. Take a break. We'll see you in a few minutes.